Before I had the surgery, I was pretty unhappy with my nose. It had a big bump and it kind of was wider on my face. So I knew I wanted to have it when I was like probably hit high school. And so I waited till after I graduated and did it.
So Melanie had a few issues. She had a very broad nose. Both the bone structure as well as the tip were very broad, and the tip of the nose dropped a little bit, and it was also undefined. So the goal for Melanie's nose was to narrow it, to narrow the tip, to raise the tip, and give her better definition, including straightening the septum internally.
When I initially came to see Dr. Genecov, he took me in for a consultation, and he took photos of the side and the frontal view of my nose, and then he showed me on the computer what it could look like, and I was pretty happy with what he envisioned for it. Dr. Genecov told me, it was a big decision to make, but he talked me through it, and any questions I had about pain or what it was going to look like, he answered them.
Noses are a little bit different. They require a little bit more time. So when I talk to patients about rhinoplasty, it's important for me to understand what the patient wants. The first thing I do is I sit down and talk to the patient, and I ask them what bothers them. I ask them, kind of what they think they want their nose to look like. Additionally, I ask them if they have any functional problems, breathing problems, if they ever fractured their nose. The other thing that I do, I think, which may be a little bit different, is I do computer imaging after the patient has decided they want an operation. I want to make sure that the patient sees patients of mine, their befores and afters, and kind of sees, that looks like my nose, or that looks like my nose, and I like that result.
Before I got the rhinoplasty, I was definitely self-conscious of my nose, always trying to hide it, and because it was the main focus on my face because it was wider, and after, it's definitely balanced out, and so it made me a lot more self-confident.